All right, guys, so my final paper was written on tech companies help battle COVID 19. So, just a little bit of a COVID 19 timeline. So, COVID 19 is one of the scariest things we as a society today have had to face, if not the scariest. The first case was discovered on December 31st, 2019, in Wuhan, China. The virus would gain its name on February 11th, 2020. And it stands for Coronavirus Disease 2019. That's where the uh, COVID comes from. Um, the first reported death in the United States was on February 29th, 2020, in Seattle. And because we live in Michigan, had to include it. Michigan Governor Gretchen Whitmer instituted a stay-at-home order on March 24th, 2020, and as of yesterday, extended it to May 28th. Panic and loss. So, obviously, with this pandemic, major panic and losses come with it. Much loss in the death toll area, but also a ton of loss in the business and job security category as well. According to an article on Fortune.com, at the highest levels of unemployment following the 2008 financial crisis, there were 15.3 million jobless Americans. It's a lot of jobless Americans. And then you have the unemployment rate as of right now being about 25.6 million and counting that have already filed for jobless claims. So just to put that in perspective, that is a 10.3 11.3, my bad, 11.3 million person difference between the financial crisis that happened in 2008 and the coronavirus epidemic, or pandemic, sorry. So the FAAMG 5 contributions. There are 5 big tech companies that make up the FAAMG 5. Facebook, Amazon, Apple, Microsoft, and Google, or as it was called in the article that I found this on, Alphabet. There are 4 categories in which the FAAMG 5 have contributed money to, which are social businesses, small businesses, my apologies, media and news, healthcare, and relief efforts. And I'm going to get into the breakdown of each company and then how much they've allocated all together and between each of the 4 categories. So first we have Facebook contributions. Facebook has contributed a total of $248 million, with $100 million going to small businesses, $103 million going to media and news, $25 million to healthcare, and $20 million to relief efforts. Amazon's contributions. Amazon has contributed a total of $72 million, $6.5 million to small businesses, $20 million to healthcare, and $67 million to relief efforts. My apologies, that is actually $83.5 million, not $72 million. So the article's math didn't add up. My apologies. Apple contributions. Apple has contributed a total of $22 million. So $15 million of it went to relief efforts, and then $17 million went to China-specific relief efforts. So you'll see that here, see that play out here as the next couple go on. They have a category for relief efforts, and then specifically China relief efforts, because China was kind of ground zero for this whole thing. So, these businesses have wanted to help them out as much as they can. Microsoft contributions. So Microsoft has contributed a total of $27.5 million, $20 million to healthcare, $6.5 million to China-specific relief efforts, and $1 million to regular relief efforts. Google has contributed a total of $856.5 million dollars, $575 million to small businesses, $6.5 million to media and news, 270 million to healthcare, and 5 million to relief efforts. So obviously Google has contributed the most out of all five. Big shock. So $1.25 billion allocation. So all five FAAMG companies have contributed a total of $1.25 billion altogether to the four categories, and the China specific category, which really should have been five categories. And they add up to 681.5 million altogether going to small businesses, 109.5 million altogether going to media and news, 335 million altogether going to healthcare, and 113 million to relief efforts, and 13.5 million to China specific relief efforts. So tech companies are not only using their technologies to help out, they're also using their money to help out, which is great. Seeing them give money to small businesses, seeing them give money to healthcare, it's kind of the philanthropy you want to see from these major companies. So how AI is pitching in to help. In an article from GeekWire.com, Oren Etzioni, CEO of Seattle's Allen Institute for Artificial Intelligence, and AI2 Senior Assistant Nicole DiCario told the site, via email of course because they can't meet in person, AI is playing numerous roles, all of which are important based on where we are in the pandemic cycle. And here's how. Searching through data. One way that artificial intelligence is helping researchers sift through the data collected to find potential treatments. So artificial intelligence is sifting through a bunch of data. In the article, there's a quote. The COVID-19 Open Research Dataset, CORD-19, an initiative building on Seattle's Allen Institute for Artificial Intelligence AI2 Semantic Scholar project, uses natural language processing to analyze tens of thousands of scientific research papers at an unprecedented pace. So what this allows for is any kind of outliers or indications or anything that could be of use to determining whether or not some people have the virus. And they're using natural language processing, which is an aspect of artificial intelligence for all who are in the artificial intelligence class. We learned that pretty quickly. So yeah, they're using that to search through data. Another one is by mapping infected cells. Another way that artificial intelligence is through computer models now mapping out infected cells. So COVID-19 invades cells through spike proteins, and they take different shapes in different COVID-19 cases. So not every single spike protein is the same. Not every case of COVID-19 is the same, which is why people are reporting different kinds of, symptoms and different levels of severity of the symptoms. The University of Washington's Institute for Protein Design mapped out 3D atomic scale models of the SARS-CoV-2 spike protein that mirror those first discovered in a University of Texas Austin lab. So this is a little bit different than the COVID-19 spike protein, but the fact that they're able to map out the 3D atomic scale of this spike protein means that they could probably map out the one for the COVID-19 spike protein, which is very, very, very good. What the information is that is gathered from these computer model does is it allows the scientists at UW's Institute for Protein Design to work on creating new proteins to neutralize coronavirus. So this allows these scientists from not just UW, but all over the world to start working on vaccines or medication, which, in fact, 40 different companies are working on vaccines as we speak, and 3 of them have already made it to human trials, so they are really, really speeding through the process, really, really getting through it. And it's going to be interesting to see because, it was just one of those things where even though I haven't been infected I don't have the COVID-19 virus. Um, it's nice to know that if there were any signs, I could just either get a vaccine, take a medication, and it would dampen the effects at the very least. So, and finally, limiting human interaction. So, one of the biggest preventatives of the coronavirus is social distancing and limited human interaction. We've heard it. We've all heard it. Keep 6 feet apart. Stay at home. Don't go out unless you absolutely have to. Stay away from large crowds. All of that, we've heard it all. Robots are replacing clinicians in hospitals, helping disinfect rooms, provide telehealth services, and provide and analyze COVID-19 test samples. So, robots are a part of artificial intelligence. The article entails that there are 2 Seattle medical startups that are currently using technologies to help hospitals across the nation. So, as we speak, there's some startups that are helping out by, implementing robots. And these robots are kind of, taking people's jobs. In all reality, it's limiting the amount of contact between infected and non-infected. And of course, this arises some concerns in the unemployment area. Robots taking over people's jobs, and they're taking over. And in my opinion, at the very least, after all this is said and done, robots are going to be an even more integral part of what we do as in the medical field. They're going to help out tremendously, immensely, and I can't wait to see how that happens. So there are ethics and privacy concerns, as I stated in my my fourth presentation. My last presentation. According to a couple of articles I found, the U.S. government is using location data or geo-tracking from smartphones to help track the spread of COVID-19. The way this geo-tracking works is they use people's smartphones to estimate where they may go through the course of the day to collect data on how quickly the virus could be spreading by the abundance of people in each place. So, this poses a big question, probably the biggest. Are we as a nation ready to surrender some privacy in order to end this virus? The operative word there being some. Some privacy. Not all privacy, some privacy. My humble opinion, I am willing to give up some privacy to end this virus because I want to get back to normal as soon as I possibly can. My life has been nothing less than normal since all this started. So I would like to get back to normal as soon as possible, and if that means having to give up a little bit of my privacy, I may be willing to do it. So the WHO meeting. The WHO stands for the World Health Organization, and they held a virtual roundtable with 30 of the world's leading technology experts on April 2nd. The goals of the meeting were as follows. To introduce WHO's digital health and innovation efforts for COVID-19 and seek support from the interested technology companies in the design and execution of those initiatives. To build on WHO's COVID-19 efforts through new collaboration and knowledge sharing to deliver targeted solutions through a coordinated effort to support countries facing stages of this epidemic in different ways and different times. To share and explore known gaps and areas that lack focus. Topics include user-focused solutions combating misinformation, supply chain management, applications supporting healthcare workers, community engagement platforms, support knowledge management capacities, research and development support, and finally, recovery planning work. And finally, secure volunteer and pro bono resources from global tech companies to design and execute response initiatives with WHO, or the World Health Organization. Supercomputers. Supercomputers are helping in the fight against COVID-19. The director of IBM Research, Dario Gil, writes in an article about how supercomputers are helping in the fight against COVID-19. In this article, Gil writes, IBM Summit, the most powerful supercomputer on the planet, has already enabled researchers at the Oak Ridge National Laboratory and the University of Tennessee to screen 8,000 compounds to find those that are likely to bind to the main spike protein of the coronavirus, rendering it unable to infect host cells. So while AI is helping in figuring out what these spike proteins look like and being able to map them, supercomputers are helping find the cure to them, or the detriment to these spike proteins, which is pretty cool if you ask me. Dell Technologies, in an article for Forbes.com, Patrick Moorhead wrote about a recent conversation he had with Doug Schmidt, the president of Dell Technology Services, about the efforts in which Dell as a company is making in the fight against COVID-19. One of these is taking care of its employees. According to Schmidt, 99% of Dell's services workforce was enabled to work from home in just a few weeks. Furthermore, it managed to do this without causing any major disruptions to its customers. So while 99% of its workforce went remote, it didn't affect their customers, which is very, very convenient. So Dell Technologies continued. Dell is the main IT provider for a hospital in Wuhan, China. The hospital had an HVAC failure, which resulted in a system outage. The system outage prevented hospital personnel from assessing thousands of patient files. In order to mitigate the solution, Dell says it assembled a cross-functional team of engineers who worked for 20 hours straight overnight to gain access and repair 100% of the affected files. Just think about that. An HVAC failure rendered their system completely unaccessible, and in 20 hours, Dell had it back up and running. That's pretty amazing. Drone technology. In an article on mdlinks.com, it is explained that many nations across the world are using drones to help in the fight against COVID-19. During a pandemic, drones offer a lot of advantages. For one, they can minimize human interactions, preventing viral transmission. Again, biggest thing we've all heard, social distance, stay away from people, stay away from large crowds. Drones can help in that aspect. Different nations are using drones in different ways. So China uses it for crowd control and medication and supply transport. Australia uses it for patient monitoring. Ireland uses it for medication and supply transport. And the United States uses it for medication and supply transport. Drones are some sort of aspect of AI, possibly because of the robot aspect of it. So that's just one more way that AI is helping. One more way that technology in general is being used and being useful. Hands-free door openers. This is one thing that I found that's actually pretty interesting, and it's not too much of a technological advance as much as it is using 3D printing. We have been urged during this pandemic to wear masks and gloves to prevent the spread of the virus. For some people, this is hard. Like my mother, for example. She has terrible anxiety and can't wear a mask and gloves before feeling trapped for more than 5 minutes. Some people are like that. They don't like having something over their face. They don't like having constricting. My mom's one of those people, and she bears and grins it and pushes through it. I don't know how she does it, because her anxiety gets very, very bad, but she does, and I commend her for that. It is explained in an article from weforum.org that companies are creating hands-free door openers. From hands-free door openers that can be 3D printed to basic ventilators, the COVID-19 pandemic has ushered in a new era of urgent innovation. These hands-free door-opening devices are hook-shaped and pocket-sized and help people prevent themselves from having to touch doors that others may have touched, preventing the spread of germs from a direct contact. So simply, all this does is prevent person-to-person secondary contact with a person, because um, first contact with somebody or main contact with somebody is obviously, hand to hand or body part to body part. Secondary is by touching anything that person has touched, i.e., a door. So to have this hook that you take and you place at the top of the door, pull, or use it to open the doorknob or whatever, that's cool. That prevents a lot of the spread of germs. Telehealth and similar services. Alice Park details in an article from Time.com some technology that is already around and some new technology that has been invented to combat the virus. Telehealth has become the forefront for all medical appointments not related to the virus. In Singapore, more than 1 million people have used a popular health app called Mana Doctor, founded by physician Dr. Sia Tung Yang for virtual visits. 20% of the physicians in the island country offer some level of service via the app. The U.S. has some other at-home devices and services that they are using. These devices and services allow patients to measure dozens of health metrics like temperature, blood pressure, and blood sugar several times a day, and the results are automatically stored in the cloud, from which doctors get alerts if the readings are abnormal. So my reflection on this. When doing the research for the paper, I discovered that while there haven't been major technological advances to help in the fight, the work that these tech companies are putting together in the fight against the virus is astounding. Just the monetary donations alone from companies like Google, Facebook, Amazon, Apple, Google, it's help enough in its own right. That's going to be enough money to keep small businesses open, to keep healthcare going, to keep relief efforts going. Just that alone is astounding. And to be a computer science student and to know that something I may do in the future may help change, improve, or even save lives is just an awesome and fulfilling feeling. I feel like I have some sort of purpose with it. And that's just so cool. Again, hope you guys are all doing great. I miss being able to talk to you in person. Have a great summer, and I'll see some of you in the fall.